Having the background of naturopathic medicine and the PA, I've kind of worked in a few different fields. As a PA, I worked in the ER for a short bit and then urgent care as well. But primary care was my big love because I really like the continuity of care. Patients don't want to just be reactive. They want to be proactive. And that's part of family medicine too. We're trying to get you to live much longer the best we can. So we try to be as proactive. And that's the beauty of primary care. We see them over the years. I've seen some patients for the last 20 years. But burnout's real is like the nice thing about it. There's a lot of treatments we can offer and testing. We look at things like cortisol levels. We looked at herbal treatments. We look at medication. That's the other thing about burnout is like we have a lot of tools at our disposal with functional medicine to address that. What is the root cause? Is it home life? Is it PTSD? Is it the jobs?
Hi, I'm Dr. Michelle Leary. I'm host of the new Vita Vitality podcast. We're so excited to bring this to you. It's been in the works for multiple years. This is a way for our doctors, guests, people who are experts in their field to then bring real-time information on what they're reading, what they're talking to their patients about, what they're passionate about, and translate that information directly to you. Welcome to another episode of the Vita Vitality podcast. My name is Dr. Michelle Leary, and I am joined today by my esteemed colleague, friend, mentor, Dr. Michael Corsilles. I have known Michael since my first year of medical school when he was allowing for student preceptors to come in. He generously took on an eager first year, and he hasn't been able to get rid of me in the 16 years since then. And we have the fortunate opportunity to work together now. So I'm really excited about doing this podcast with you, Michael. A little background just for our listeners of who you are and where you came from. You studied at the University of Washington for your undergraduate degree in a concentration in Asian American studies, but a focus on American ethnic studies, bachelor's degree. You then went on to Bastyr University for your naturopathic doctorate, where you completed your medical naturopathic training in 2002. You then decided to work for a few years and then return to a medical training program at the University of Washington to become a physician assistant. So you completed that training in 2009. Is that correct? 2009, you finished that?
2010.
2010.
Yep.
So about 16 years since you finished that. So you're dual licensed. You have kind of two different ways of thinking due to your training, conventional and naturopathic functional. You have been working as a clinical preceptor for the UW Medic PA program, as well as you've been my co-residency director at Vita Integrated Health, taking on naturopathic medical graduates and training them to become primary care physicians. And you've done primary care your entire career. So I'm really excited to have this conversation with you about how we take care of people. What does that look like? And just dive into what do people really care about when they're seeking a primary care doctor. Welcome.
Well, great to be here. Thanks for having me. And
Yeah.
I love working with you too. So it's great to keep that connection.
Yeah, it's so fun. I give you a hard time sometimes, but it's so fun. Okay, I really want to dive in here because you just have such a wealth of knowledge and experience. And I think that being able to explore what you have seen in the last 25 years of clinical practice, I want to start actually with functional medicine versus naturopathic medicine. This is a big conversation in both camps. Is what are the differences? What are the similarities? I think that there's not just one definition, at least for me, but I'd love to hear your way of thinking about the two and how they meet and why you've focused your practice on this functional hybrid. Yeah, so that's where I'd like to start.
And you're right that there's all these different definitions of functional medicine, but it's a great It's a great opportunity for patients to have access to functional medicine, but the big question is like, what exactly is this functional medicine? So the big difference for me with naturopathic medicine and functional medicine is just the structure of functional medicine. So there's different a big thing that like at least I like to focus on is looking at all the different systems of the body. And so in naturopathic medicine, we'll look at the different systems too, but with functional medicine, it's more of a streamlined type of algorithmic type of practice. So it's like easier for us to have a kind of a system and a flow. The one drawback, some people might see it a benefit. I guess the one type of drawback could be with naturopathic medicine. There's just so many different type of things you can go into. There's just too many modalities you can do. Whereas this is a little bit more fine tuned, so we can really make it more patient focused, in my opinion. So we look at various body systems in the body because all these different systems can interact, and we know that they interact. Like a good example is like if you have super high stress, yeah, you can have a lot of anxiety and depression, but that can negatively impact your gut, your gastrointestinal tract, and that can negatively impact your hormones, and that can negatively impact like anything from fertility to periods to uh, semen analysis. So all these different systems are all tied in, and we like to look at those different body systems and then just kind of go from there. So it is a more personalized, individualized kind of treatment where we try to search for like a root cause. I think that's a good kind of focus too, is what is the root cause? They might have this particular GI condition, but why? Or why are they having fertility issues? Or why are they having hormonal imbalance? What is the root cause? It's just one system. Often it's not. It's usually multiple, but is there one big root cause? Is it something in diet, something in the environment, it's a stress, or is it a combination? So that's part of our work as doctors is be really detectives, but it's nice to have this system in place to help us look for the answer for all these medical issues.
An operating system of sorts of how to organize your thought process, clinical imbalances. And I think that you and I would both agree that naturopathic medicine has absolutely so many great core philosophical overlays to functional medicine. But at least for me, functional medicine really took some of the pieces that I really resonated with in naturopathic medicine and made it more evidence research based, maybe a little bit more modern in some ways. And they're not mutually exclusive, as you and I both use botanicals often in our practice as an example. And that is
Yeah.
definitely a strength of providers who have naturopathic medical training or pursue additional herbal medicine training. Great. I love that overview. I'd love for you to define for me why you chose to go into primary care, how you have evolved in your practice style over the last 20 plus years,
Mhm.
and what you think about in terms of things that you really love about practicing family practice medicine. What excites you in that
Yeah.
way?
Yeah. So being having a background of naturopathic medicine and the PA, I've kind of worked in a few different fields. That's PA, I worked in the ER for a short bit and then urgent care as well. But primary care was my big love because of I really like the continuity of care. So I like to follow it with patients. Like working in the ER, urgent care, you just kind of see them one time, never see them again, you refer them back to their primary care. So I like the true family medicine, which is primary care. We used to see newborns, and we see a geriatric population as well, so we see the whole gamut. And that's what I like. I love to see like I might see the parent of someone and I'm not just seeing the child. I also might see the grandchild. So I like to see the whole connection there. But I really like to be a part of that team. And so that's why primary care is really good. And I really like to establish that connection. And that's super important when you're trying to find a good primary care provider, is that connection. And you really need that teamwork with the other person too. I can't just dictate things like working at urgent care. So I'm like, you got to take this antibiotic for this, whatever. But in primary care, we have a lot of other options and to work as a team. And we kind of thrive that way. And patients don't want to just be reactive. They want to be proactive. And that's part of family medicine too. We're trying to get you to live much longer as best we can. So we try to be as proactive. And that's the beauty of primary care. We see them over the years. I've seen some patients for the last 20 years, which is great to see. And I'm like, you need to change your picture in your patient profile because she looked totally different now. So it's also just a pleasure to be able to see those changes. So like we have weight loss patients, or we have patients who have chronic fatigue or hormonal imbalance. We love to see those kind of changes. So it's nice to actually treat someone and see the good progress we're actually making. Because we all kind of go into medicine to help, really,
Yeah.
but it's a little bit different when it comes to primary care. We can actually see those results too, and we see the hard work in patients paying off as well.
Yeah.
So I love it.
Yeah. In the last certainly decade that I've been in practice, but I presume you've seen this evolution prior to that, is there really is this loss of the family practice physician being even accessible to the average person. That this family practice physician has been, unfortunately, I think, replaced by systems that are less and less personal. And with the advent of our technological age and I think people are craving that connection more than ever with another human. It doesn't mean we can't take advantage of the technology, but that connection. And so, if I'm
Mm.
hearing you correctly, that's really from a practitioner standpoint, you really love that connection. Is that correct?
Yeah, and you bring up a good point too. Is like, yeah, the old school primary care physician is, man, that old system's gone. Because unfortunately, how U.S. healthcare systems, I do have to be a little bit political, and because it's not new, the U.S. healthcare
Yeah.
system, and it's no one's surprised. There, it's failing, and it's not new. It's been going on for like 20 plus years, and it's just not getting better, unfortunately. So that's why, yeah, you try to find that connection, but then like, oh, the next follow up is like a month at least from now.
Yeah.
So we had to make some of the changes, but there's some consequences, not just for patients suffering because they don't have that connection. Like, I don't want to see a new person. I've established this rapport with this person. They know my history, so I want to
Yeah.
see them and not see hopefully not an AI person in the future.
Yeah.
Even though we use AI every day in medicine and of course outside of medicine too. But it's just U.S. healthcare system, and so that has bred a lot of providers just burning out and leaving the system too. Unfortunately, you and I hear so often patients are like, "Yeah, I did have a good PCP, but they left," and it's not necessarily just leaving to a different job. They're just like leaving the industry now too. So there's
Mm-hmm.
a huge shortage of doctors, other providers in specialties, but also primary care. So it's a
Mm-hmm.
really broken system, unfortunately.
How has becoming a concierge provider changed your practice? How do you think you are able to take care of patients differently since that decision we made together in 2023? Can you just
Yeah.
briefly share that?
Yeah. Yeah. It's been 3 years since we switched over to concierge medicine. So concierge medicine is great. Patients like it because it's all about accessibility, longer visits. Like my follow-ups used to be like 20 minutes. Now my follow-ups are like 45 minutes. And now I have time to investigate, do the right testing, and not just stereotype patients like, oh, you just need this or you just need that. We have time to actually do more testing. So for me, I've been able to be a better provider. I'm like, I'll catch things. Whereas before, I'm like, hope I didn't miss anything in that quick visit. But that's part of the broken US healthcare system. There's just way too many patients, not enough providers, and too short of visits.
Yeah.
So with concierge, you do have the accessibility to your doc. So we're trying to bring in that old school medicine where you develop that rapport and that connection, where they know your history. You don't have to repeat your whole history every single time you need to see someone new. So I like it too because, I used to see like, 20 patients a day. Now I'm like 7 or 8 patients a day. So it's
Hmm.
for me on us doctors end, it's much more manageable. So we're
Hmm.
not burning out. And again, better quality care. And of course, it's a
Hmm.
win-win for the patient.
Yeah.
So
Burnout is huge, not only for medical providers, but also the patients we serve. Of course, our social media feeds are always bombarded by our
mhm.
individual circumstances and perhaps what we're searching. And right now, my personal social media feed is bombarded by women in their early 40s who have young children at home who are working full time. And I'm like, how did it know? It talks a lot about this burnout presentation. And I would say this is the typical patient that is walking into our office. So,
Mhm.
can you share what you're seeing as some of the classic presentations of a patient who they may or may not be in the medical field, but what is burnout really? What do you look like?
Yeah, I think burnout's probably one of our top chief complaints we typically see, right outside of like anxiety and insomnia and fatigue, which is all tied in with burnout. And so all of us know this term burnout, but it's an actual thing. So the official term is like adrenal insufficiency. And so those folks can have the things I had mentioned, like anxiety, depression, fatigue. Even though they're tired, they can't sleep, and they're like, "What's wrong?" And so, and that's like the tip of the iceberg, is because there's consequences to burnout. But when it comes to just the adrenal insufficiency, like us naturopaths, functional medicine providers, we've been talking about it, burnout forever. But now I'm loving it that the conventional medical community is realizing it. And we just see it so often because, again, that's like the top chief complaint. So it impacts things like it can impact weight, can contribute to
Hmm.
weight gain. It can contribute to like
Yeah.
diabetes, high blood sugar, the insomnia, the fatigue. It also throws off the hormones as well, and it even throws off the gastrointestinal tract. So it's tied in with all the different body systems. This burnout. But the $1 million question is, what do you do about it? Right? I'm like, yeah, go on vacation, go to Hawaii for a couple of weeks. But the root cause is like you go back to work and starts all over again. And
Hmm.
so, like you and me, we'll fill out these time off requests using FMLA, short-term disability. But like at the end of the day, you're gonna have to go back into that environment that's triggering this burnout. And like, unfortunately, 99% of the time, it's secondary to work. And so that's a big thing with our culture here in the States. It's just all work, work, work. And a lot of us are parenting, or we might be parenting our parents even, where we're kind of
Hmm.
stuck in those
Hmm.
generations. And then we got our jobs too, where we're managing a lot of things. With you being a medical director at Vita, I was kind of joke around. You're kind of babysitting us doctors as well. You have a lot to deal with. So
It's easier
burnout's
than my
real.
my son.
But burnout's real is like the nice thing about it. There's a lot of treatments we can offer and testing. So we look at those other systems. We look at like things like cortisol levels. We looked at herbal treatments. We look at medications. That's the other thing about burnout is like we have a lot of tools at our disposal with functional medicine to address that. What is the root cause? Is it home life? Is it PTSD? Is it the jobs? Like a lot of us are just kind of stuck at their jobs, married to our jobs, and we're always going to be doing this for like the next 30 plus years or whatever. But yeah, burnout's real. So I can talk all day about burnout. Is there something specific that you
I
want to?
think I want our audience to understand physiologically, and you alluded to this adrenal insufficiency. So I'm wondering if you could define that a little bit further. And then if you could explain how that then impacts other hormonal systems. You had mentioned it impacts sex hormones. And so I'd love for us later to pivot into men's health. So how
Yeah.
does a adrenal dysregulation impact other endocrine systems, including testosterone production, for example? How does
Yeah.
that impact insulin sensitivity? And if somebody is always tired, what is thyroid function? How would that be impacted? And if it's normal, what are other explanations for fatigue, for example? What else do we
Yeah.
need to look at?
Yeah.
And then maybe we can talk a little bit about what some common treatments are that we typically recommend.
Yeah. Okay.
Yeah.
So there's a good analogy I usually tell my patients when it comes to cortisol results. But first off, when it comes to cortisol testing, cortisol is the main stress hormone. We always think adrenaline, but that's more like just the signal. You see a bear, you run away from that bear, and then, but cortisol comes out and that does all the heavy lifting. So that impacts the rest of the body. And there's different types of cortisol testing. So a common one is just like looking at blood, like a morning cortisol blood test, blood draw. So you go to your provider, they do a morning cortisol, and that's that when it's at its peak. Because cortisol is a stress hormone. We usually make a lot more cortisol in the morning time to wake us up, give us energy throughout the day to help us deal with stress, right? So we want to measure it closer to its peak and try to see the reference range. And the one thing about that, just that by itself, or just I guess tests in general, in functional medicine, we always want to optimize everyone's health. So there
Mhm.
might be a reference range for cortisol or vitamin D or testosterone or whatever, but there's like an optimal range where we usually want our patient. Again, we try to individualize everyone and not stereotype everyone. So not everyone fits in the box, as everyone kind of knows. So when you do the issue with the cortisol in the morning, I'm like, that's a fine test to do. That's the most common one to do. But I actually like to do, or we like to do more of multiple samples throughout the day. So there's a good example of just a salivary cortisol test. And so you're checking like an cortisol waking response. First thing in the morning, you get this big spike. How big of a spike are you having? Is it kind of blunted or is it like
Mhm.
vertical? So we want to see how big of a burst of cortisol are you having, and then how does it trend throughout the day? So cortisol is very high in the morning and then trends to almost nothing at nighttime because you don't need stress hormone at night, right? You need just to sleep. And so we like to look at that trend because there's some people who might be good in the morning, but other times of the day it might not be so good. So it's good to see that overall trend and even how it changes over time. And there's ways to influence that cortisol, right? Besides just taking vacation. So the analogy I often give patients is think of cortisol like, well, patients who have been on like a steroid like prednisone. Prednisone is a big steroid, anti-inflammatory. Like if you have crazy neck pain or something, or crazy flare up of, there's some people with autoimmune conditions like really bad pain. We'll put people on prednisone short term. The reason why a lot of us typically do short term, just to lower inflammation, help with pain short term, is because there's side effects if you're on prednisone long term. Right? There's people who are on it long for a long time, but like if you have an autoimmune condition, you might be started on prednisone, but they're eventually going to switch to something better, right? So the preference is not to be on prednisone. But when you're on the prednisone long term, the side effects are like weight gain, and you can Google all this stuff like weight gain, blood sugar issues, weaker immune system, hormones are all thrown off. And so
Loss of
that's
bone
the
density.
consequence. Bone
Mhm.
density issues, yep. And
Mhm.
so when you have, think of prednisone as like a synthetic version of cortisol. So cortisol will be made in abundance under tons of stress. If your body is being attacked by a bear and that bear is attacking you all day, every day, the body's going to respond in kind by pumping out a bunch of cortisol. So if you're on prednisone long term, that's and you have high stress long term, that's like the same as if you're on prednisone long term. So you can influence like insulin resistance, making you more prone to weight gain, making you more prone to diabetes. Secondary, just high cortisol, high stress. So we don't like that. But the body can't differentiate being attacked in a war or just being at your job at the desk typing away. We're not really
Mhm.
burning off this excess cortisol because we're just sitting at the desk and not exercising.
Mhm.
And
Mhm.
so we don't like prolonged high cortisol either, but the body's like, hey man, we need to survive. We got this
Mhm.
anxiety, depression, and all this stuff going on,
Mhm.
fatigue. We need to keep producing this cortisol. So it's to do whatever it takes to keep making all this cortisol all the time. But you end up having all these consequences. Now, some of these like ingredients to make hormones, the easiest way to think of it is think of these ingredients that make the hormones, like testosterone, for example, gets shunted towards cortisol production. But the body is also for cortisol. It also needs a bunch of other ingredients too to keep up this healing and this in survival mode. It starts depleting all
Mhm.
the resources for your mitochondria and
Mhm.
your adrenal glands. So like B vitamins, antioxidants, et cetera, et cetera. So all of
Mhm.
those take a hit. And then
Mhm.
even impacts melatonin production. So
Mhm.
melatonin, the sleep hormone, takes a hit as well, and then you can't sleep either. So we need cortisol, but we can't sustain that high output. So
Mhm.
yeah, go on vacation, but we
Mhm.
can't. So what do
Mhm.
we do? Then we talk about testing and all the looking at the other body systems and how to correct those while we heal up the adrenal glands. So
Yeah.
there's
Mhm.
there's there's so many ways to treat the adrenal glands. There are, of course, all the lifestyle stuff, right? Like good diet, good exercise. You got to feed yourself with all the good fuel that your body is just always depleting all the time. So if you're eating zero vegetables and just junk food all day, you're really going to be suffering. You're not going anywhere. So often we have our patients like by default just meet with our nutritionist, Jackie, all day, every day to see, are you getting enough of the good nutrients to feed your
Mhm.
mitochondria, your brain, feed
Mhm.
your adrenal glands, and then are you getting enough exercise? If you are getting exercise, because we have a lot of patients who are overweight, right? The big misconception with the patients who are overweight, wanting to lose weight, they're like, oh, just go cut my calories and work out like
Mhm.
crazy. But they all end up just taxing their adrenal glands even more, leading to worse burnout because you're not giving yourself any fuel when you're trying to do these
Mhm.
heavy workouts. You're just depriving yourself those nutrients, and then the body's like, hey, you're doing a heavy workout, we need energy somewhere, so we're going to start taking it from your muscle. You start losing muscle. You might lose weight, but
Mhm.
you're like, I don't feel as strong. And so that can be
Mhm.
corresponding with like the low testosterone as well.
Mhm.
So for anyone suffering from burnout, like we got to check some hormones. And more often than not, they're
Mhm.
having some hormonal imbalance symptoms
Yeah.
too. So lifestyle, good diet, good exercise, stress reduction, super key is the work-life balance. It's a cliche, work-life balance, but a lot of people just don't practice it.
Yeah.
And work-life balance can be setting boundaries. but we have patients where they're like, well, I get this deadline again, and my boss is making me work 60 hours a week. I don't want to lose my job. I don't want to disappoint my team. So you don't have that work-life balance. You don't have the boundaries. And so a lot of people feel like they're stuck. The nice thing about us at Vita, man, since moving to concierge, that's really helped any adrenal insufficiency concerns that I have because better
Mhm.
work-life balance. So you got to do whatever it takes to try to save yourself. And unfortunately for
Mhm.
men, we often don't do that. I don't know if it's just a
Mhm.
learned behavior we learned from our
Mhm.
fathers and grandfathers who
Mhm.
just keep learning this behavior where we often men usually don't come in here by themselves. It's usually they're drug in by their significant
Yeah.
other. They're like, "Oh, what brought you here?" Like, "Oh, my girlfriend told me to come in. I don't know why I'm here, but I am tired and all this stuff." So a
Mhm.
lot of guys, it's a learned behavior of not being proactive, unfortunately. So it's like you gotta make yourself the priority. So establishing those work-life balances at work and even at home too. And so it's a hard balance, right?
Yeah.
We preach a lot on the work-life balance, but then me being older, you know, like this, I'm always like, man, this newer generation, they don't have the same work ethic. I'm like, that's what my dad would tell me about me. But now I'm saying it. And they're like, you don't know what it takes to work. You got to just put your head down and go to work. So there's a fine balance because you need that work life balance. But the thing is, if you're in a team, if that person's taking time off, so I hear this from my patients when they request time off. They're like, now if that person takes time off, the rest of the team has to suffer. Is going to suffer because they have to pick up the slack. So I'm like, it's not an easy answer. So there are some patients where we'll work on specific adrenal burnout type of things. Sometimes we need to turn to medications because they can work quicker. A lot of times we'll do a combination, like like a beta blocker, which kind of lowers that heart rate, that lowers that adrenaline rush. It's a medication. So some people will put them on a beta blocker just to help some of that panic attack symptoms,
Mhm.
all that while we work on the adrenal stuff. And that can be things like the work-life balance, counseling, therapy, nutrition. Sometimes we may talk about adaptogen herbs. Just
Mhm.
think of those helping you adapt better to stress. And that can be things like people always hear about like ashwagandha, rhodiola, licorice root, even. So there's a ton out there. And
Mhm.
luckily there's a lot of acceptance and desire to be on that stuff. And so we're here for all those folks. And so the beauty is, again, best of both worlds, because those supplements don't always work quickly. But you can say the same thing about like antidepressants. I might start you on an SSRI, and that might take like 4 weeks to kick in too. That's why we all often look at the different body systems as well, just to kind of get a little bit quicker results.
A lot of important points. So I'm going to try to break some of those pieces down. You talked about the importance of exercise, but you also talked about how it can also exacerbate burnout. And so I want to drill down there a little bit and talk
Mm,
about how perhaps we need to think about more non high intensity exercise, at least initially, or smaller chunks of higher intensity exercise, and how we can feed our body appropriately for that high intensity exercise if that's what's going to fit
yeah.
into somebody's schedule. Two, I want to maybe touch on what nutrients do we commonly see people are not consistently able to get through diet, and what kind of nutrient supplementation is important for people with burnout. You mentioned B vitamins
Mm,
before. So maybe we can start there. Maybe we can go back to the
yeah.
exercise conversation
Sure.
and what guidance do you typically provide? And then nutrient wise, what do we really need to think about to support somebody's ability to then be
Mm.
robust in their adrenal and the rest of their bodies?
I like that we have an exercise physiologist and that we do VO2 max testing. And for the listeners, VO2 max is just think of cardiorespiratory kind of health, so heart and lung health. And we want to try to tax it and stress it out and see how it performs under high stress. And so you run on the treadmill with the mask on under the supervision of our exercise physiologist, and you're seeing how good do you perform compared to your peers. And so are you kind of above average or you're pretty low? But it is something that you can improve. And so there's some people who get a baseline VO2 max and are like, man, this is not a good score. You really shouldn't be
Mhm.
pushing yourself this hard. That's probably leading to more adrenal insufficiency and burnout stuff. So
Mhm.
not the best thing to do.
Mhm.
So it's good to get a baseline of all these things. And
Mhm.
we like to look at these labs testing just to get the baseline and seeing the objectively how it changes over time. All right. So when it comes to exercise, everyone has different pace. Like our nutritionist Jackie, she's like an ultra marathon runner. She thrives on. For me,
Wild.
cannot do that. It stresses me out just thinking about that. But she thrives on that. So there's some people who can
Mhm.
do that. Whereas if I try to do what Jackie's doing with running, because the type of exercise I do, I play basketball like twice a week. That's very different than what these marathon runners are doing. And so my body is not prepared for that. So it's nice to have like a trainer or exercise physiologist kind of give you get a baseline test for you and see how you're prepared. So kind of tell you what your pacing should be with exercise, weight training. I think it's a good combo of cardio and weight training. But yeah, you're pushing yourself too hard. That's too much on the system. And so you gotta
Mhm.
pace yourself and work on that.
Mhm.
Now, when it comes to nutrition, what happens under that high stress? Yeah, you lose a lot of those like B vitamins, antioxidants, but there are some key ones that people should focus on for just general health. You had mentioned some supplements like what are some things that some people should be? And
Yeah.
so an example is where you should be on something like where you're not gaining a diet. A good example is just like vitamin D.
Yeah.
Really get it from sunlight. And people who are in a sunny environment, they're often not even outdoors. They're just indoors
Mhm.
on the computer. And so I think everyone should get tested for vitamin D. The baseline is
Mhm.
see how it
Yeah.
changes over time.
Annually. Yeah, for sure. So, one of the nutrients that I think a lot about for burnout and supporting mitochondria as well as sleep, digestion is magnesium. Tell me a little bit about your thoughts on magnesium and how you dose it, what form. That's a question we get a lot. And when do we know that somebody has had enough magnesium? And when do we start to wonder if there might even be taking too much? Because I know that is something I've seen in my clinical practice.
Yeah, so there's different types of magnesium, and so there's different types for different conditions. Common one like for burnout though, it's super good to focus on one that is better absorbed. So I often recommend like magnesium glycinate, and so usually like at least like 500 milligrams. However, there's some people who need double that. There's some people who might need less. If you have too much magnesium, one possible side of it might just be like loose stools. A good example is like think of like milk of magnesia. That's like a laxative, which is like, I don't know, 2000 milligrams, super high dose. So that will cause diarrhea. So, but magnesium, that's a great topic though, because it is super beneficial and a lot of people are suboptimal. And so when you do magnesium glycinate, it can actually help for sleep. It helps kind of calm the nervous system too. So a lot of times insomnia is not secondary to like not necessarily like snoring or restless legs. Often it's just secondary to burnout and stress and anxiety. It's just
Mhm.
all that high cortisol and not enough melatonin. So I think magnesium is a great supplement for everyone to actually be on. And a lot of people are just low in enough nutrients because I think a lot of people just aren't getting enough vegetables in the diet and not getting enough
Mhm.
minerals in general. And there's even a whole layer on that. So a lot of people just don't have enough things like stomach acid, GI issues, et
Mhm.
cetera, et cetera. So I think magnesium is a great item just to take on a nightly basis. Just watch for those possible side effects. There's some people who will do other types of magnesium. It just really depends. But my go-to is usually the magnesium glycinate.
I use the same. I use threonate sometimes if there's more of a migraine presentation. There's a little bit more literature in that direction with threonate or citrate if somebody tends towards more constipation because there is more of a laxative osmotic gradient effect. I think a lot about antioxidants, as you've mentioned a few
Mm,
times with the adrenals. Vitamin C is one that is really important. And obviously, most people know you can get vitamin C from citrus, but the amount of vitamin C as a cofactor in a lot of important neurochemical and just biochemical reactions in the human body is a lot higher than maybe what some people realize. So, again, just thinking of comprehensive nutrient support, what are some of the testing modalities you use in your practice to assess if somebody has a adequate amount of nutrients, and how do you counsel them on ways to do that safely without having a million
yeah.
pills?
Yeah, this is it's a valid point. A lot of us are taking handfuls of pills, and are they working? Are they going right through you? Are you just underdosing? Do you have too much? How do we know? So that's why we like to do the testing. There's some kind of basic nutrients I usually check just for like the fatigue and burnout. So often I'll check D, omega 3s, and the D and omega 3s everyone's usually low because they're not getting enough in their diet of the D and omega 3s. But I usually like to check magnesium. a B12, a ferritin, which is like your iron reserves, your iron stores. So those are some basic ones I usually do, like recommend right at the get-go. So with the fatigue and burnout stuff, there's like some low-hanging fruit, just to make sure those aren't low. And the D and omega is usually low in everyone, so I also kind of know that. But I also want to look at these other nutrients. However, when it comes to like big burnout stuff where people are like, man, I'm on all these supplements, I'm on vitamin C, etc., magnesium, it ain't working. So I'm like, well, there's this one test I like with Genova Diagnostics, the NutrIval. And so that one is the blood and urine test. I know you know all the stuff. I'm just kind of explaining for the
Please.
listeners.
Yep.
So that one is really looking at the cofactors to support things like methylation, which is like turning on and off genes. We need that to happen all day, every day. It has to do with like, it checks, they act as cofactors for antioxidants. What's your oxidative stress? We're always losing antioxidants. We're always aging for all our body systems, but you add stress on top of that, that's adding more fuel to the fire to age us quicker and to burn out our adrenals even quicker. So it's looking at the cofactor nutrients for your mitochondria, which kind of share a lot with the adrenal glands. It checks things like even heavy metals as well in this test. So it's a good test, and it checks some inflammation as well. So it checks these nutrients, and it shows me what's your vitamin C status. I often like to look at the big ones I like to see is like the C and glutathione. Glutathione is just hard to get it in our diet or even in supplements. But at our office, we do a lot of the vitamin C IVs and glutathione IVs. These are two big antioxidants. They're super important for so many things. But the vitamin C is as an antioxidant has multiple benefits because it's like antimicrobial. So if you have like chronic infections, particularly like chronic viral infections, it's immune boosting. It's a great antioxidant. So we're always talking about these antioxidants that get used up under high stress. So often I'll look at the NutrIval test just to see where are your levels. And if levels are low, often we'll hear patients like, I've been taking vitamin C for years. And like, you're not absorbing it. Or like we always look at, are you not absorbing it because you got some gastrointestinal issues? You don't have enough, whatever, stomach acid, digestive enzyme, probiotics. Or are you using more of it because of the high stress? It's depleting your fuel sources. And then are you just underdosing?
Yeah.
Do you have a good quality product? As you know, there's like a million brands out there, and like, what's a good brand? And is it really working? So I'm like, well, let's check. So I often will check that NutrIval. So I like that. And it kind of has a little formula that says, this is how your mitochondria is functioning based on these nutrient deficiencies.
Yeah.
Like, where's your magnesium? Where's your minerals? Where's your omegas? Where's your antioxidants? And when it comes to vitamin C, it's like, you need some, I might say you might need some C, but you need a buttload of C. And so that's where we'll recommend the vitamin C IVs, because if you have too much oral vitamin C, it'll cause diarrhea. It goes right through your gut can only handle so much. A lot of people think like, oh, I'm just going to pee it out. Like, no, you pee out antibiotics too, right? So it's just, I don't know why people always say that. And when you do pee things out, when it looks like that neon, it's actually a B vitamin or riboflavin that makes it gets metabolized, and it looks that way, because we'll sometimes recommend that high dose vitamin in super high doses in your Pelix Neon.
Yeah, exactly. To your point, it has to actually get absorbed in order to get through the kidneys and get into the bladder. So that it's not just going directly from your mouth to your bladder. It doesn't work like that. So it's a good reminder. Yeah.
Yeah. And so often for folks who need vitamin C, whether that's just like from fatigue to burnout, we have these like histamine patients, we have these chronic fatigue patients where they need high dose vitamin C. You try to do that mega dose in pill form, you're for sure getting diarrhea. So when you do it in IV form, you're able to bypass the gut and really get super high doses of that therapeutic vitamin C, which is evidence-based. And so that's why we often will recommend the IV form, just 100% absorbed. You're bypassing the gut. So majority of people tolerate very well, as long as they have that negative G6PD.
I love that you brought that up in the sense of why we sometimes use IVs. And I think we should differentiate for people when we think about high dose vitamin C. We're usually using it in the context of treating a chronic viral infection, because high dose vitamin C actually acts as a pro-oxidant. As you said, it's antiviral, but indirectly in the sense that it actually helps to oxidize infected viral infected cells by helping to support that whole molecular immune system response without getting too technical. And so, burnout in that continuum, people can start with insomnia, weight gain, fatigue, and then ultimately there are these opportunistic infections that you and I see all the time that can then go from a dormant state, because most of us have been exposed at some point in our lives to this common one that I know you know what I'm talking about, which is Epstein-Barr virus, really bad actor in the chronic fatigue space. It's been very closely linked to multiple sclerosis, meaning not everyone who has Epstein-Barr virus will get MS, but almost certainly everyone who has MS has had some exposure of Epstein-Barr virus, and more and more literature coming out in that. So I'm wondering if we can just dive into the chronic infection piece a little bit, because that's, I think, a deeper layer of what can happen when somebody goes from a burnout state and they don't intervene, they don't give themselves a break, and they go into this state of their body really being truly depleted and unable to pull itself out. I know you did a lot of long COVID treatment in really the last 5 years ish since COVID. So,
Yeah.
how do you think about the differentiation? What do we have in terms of testing for these types of infections? If someone's listening and hearing you and they're like, wow, I'm really tired and I'm not sleeping, and is this long COVID? Is this Epstein-Barr virus? How do I know?
Yeah. Yeah. That's a tough one. Even like UW has their own long COVID clinic with not a lot of good treatments. We have patients who come from that office and seek further treatment with us because they haven't really gotten a whole lot of traction. So it's not an easy one to address. But there's testing like for Epstein-Barr virus. So we'll check particular antibodies. Is it like an early infection? Because you make these antibodies from previous past exposures. Are those particular antibodies high? Is there an early one that's elevated? Is there actually a viral? Should you check a viral load for Epstein-Barr virus as well? So there's particular markers that we interpret, and a lot of patients will get kind of written off because maybe the correct Epstein-Barr virus markers weren't checked. And then the other hard part is sometimes people get these flares of Epstein-Barr virus, and you're like, you might check it at this one particular time, and then like everything looks great, and it's like when you go to the mechanic and you're like, I swear there's a sound, and the mechanic's like, I don't hear anything, and so sometimes we're not catching it during a flare up, which can be tough. And so some patients, the hard part is like, well, you don't have any of like the Epstein-Barr virus markers, but you have some classic symptoms. And so that's not just a functional medicine thing where we'll do presumptive treatment. Conventional medicine will do that sort of thing too.
Yep, yep.
They're like, does it like you got heartburn? Take a heartburn medication. They don't do a scope and check all that, right? So we'll do a lot of presumptive treatment too. But we often like to do the testing. That's our jam. We like the objective data and to see the changes too. So there's Epstein-Barr virus testing, but if there is a chronic infection present, a lot of patients they don't just have like the chronic fatigue. They might have chronic pain as well, chronic inflammation. They might catch a cold super easily, and they're like, "Why am I getting sick?" Or if they and they when they do catch a cold, it takes them way longer to recover. And I'm like, man, that ain't normal. There's something else going on. We got to figure out what's going on. Sometimes it could be this chronic infection that's just lingering. Because all of us, a lot of us have been exposed to a number of viruses. Like big ones are just like herpes and Epstein-Barr virus, but not everyone gets a cold sore from herpes, right? A lot of people just, if they're exposed to the virus, the immune system's strong enough to squash it, to keep it in check, right? We're not necessarily killing it off. We're suppressing it because everyone's immune system be strong enough. But the thing is, you always have to think, you're like, why is the immune system not able to handle it? And often it's because of that stress and burnout. It weakens the immune system. So everyone kind of knows under high stress, you're going to get sick more often. High stress can cause heart attacks. High stress can cause ulcers. And so it kind of points to that burnout again. But yeah, there's a huge link. So we'll often do the low-hanging fruit tests, like what are some basic nutrients, what are some like hormones, for example. And if they're like, no, everything looks solid, then we'll kind of do the next step. Is this a chronic infection that's going on? Because we can order a million tests under the sun, But again, we try to tailor it for everyone. We try to look at your
Yeah.
history. What is so physical exam? What are your lab markers? What is that telling us? Which direction should we go? So I
Yep.
like that precision tailored medicine.
Yeah. No, I agree. And I think that it's so important for people to understand, particularly with chronic fatigue, that if the foundations of what caused your burnout in the first place, even all the vitamin C infusions in the world, if you're still
Yeah.
not sleeping or you're working 60-hour, 70-hour weeks and you're not eating throughout the day and you're not giving yourself brain breaks, meaning just like a minute or two to just get off the computer, if you're not taking care of yourself, even if we're able to reduce the viral load significantly using the higher force interventions like IVs that we have accessible, those infections can come right back. And I think that it's so important not to band-aid something, and it is a comprehensive approach. And I really think that in the context of what Jeff Bland calls immunometabolism is how our immune system, our metabolism, and then how our nervous system and our psychology, all of these things interact. And this immune metabolism, neuro psycho axis, which the gut is in there too, there's so much interrelationship there. And there is no such thing, in my humble opinion, as a quick fix. There truly is not. There is things that are easier to implement. There are things that are more accessible. And the hardest thing for patients to do with burnout is really look at what lifestyle wise are the drivers and make those changes. And you alluded to this earlier is work, right? And you and I are both extremely hard workers. We do not endorse people just taking the easy road. We've had that conversation about our residents in the past. But I do think that there's something to be said for making sure that people are evaluating what gives them joy and what gives them purpose and what lights them up. And if they're not able to get those things through their work and home interactions, if they can't achieve that, they really need to
Mhm.
take a closer look. I want to just share with you a case. It's a male patient that I think about often, and I think that he's not that different from a lot of patients that I've seen over the years, and you've definitely seen over the years in the men's health realm. And how do we get men to start prioritizing their health? I think earlier you mentioned most men come in because their partners recommended it. But how do we get men, particularly, to start seeing their health as something that we need to look at preventatively and not just when something goes wrong? So,
Yeah.
just briefly, this patient is in his mid 40s. He is the CEO of a company, it's a startup, and massive financial stress, massive pressure. He is working again that 70-hour weeks. Father recently passed within the last 5 years of Alzheimer's dementia. And on initial lab analysis, he is type 2 diabetic. He is obese. He also has hypertension, uncontrolled hyperlipidemia, just the whole kind of cardiometabolic risk factor picture, and erectile dysfunction as well. And he's about 45 years old. And I have had so many great conversations with him about why things need to start changing now, because he does have a genetic predisposition with ApoE4 to Alzheimer's and cardiovascular events like a heart attack or a stroke. But I still have not been able to successfully get him to change his lifestyle because he sees himself as the breadwinner, the provider, not sees himself, he is. And the thought of failing his family financially is scarier to him than dying from one of these things. And we've done all the meds and is on all the meds. And so I'm mitigating things similar to what is the approach conventionally. But I'm wondering, not only to me as a clinician, but just to all the patients who maybe resonate with that. How do we get men to start thinking about their health differently? As it's easier for me to see it with women and really encourage women to make some of these changes. I see men having a lot more resistance to that.
It's not an easy task. Again, it's kind of a learned behavior because I definitely saw it in my dad. He didn't. I see it in my father-in-law too. Super duper stubborn. They're like, I'm fine until you're not fine. So guys just aren't proactive about their health. It's interesting. It's everyone's different, so I haven't found the right formula. There's various techniques to try to convince them like you got to be proactive. You live to over 100. And so there's some people who do a scare tactic. A lot of times not necessarily the scare tactic, again, a time and place for those types of things and how severe are their conditions. Like, are you going to have a heart attack in the next 5 years, right? But a lot of it is just with education. Like if you have low testosterone or if you're tired, that's probably like low testosterone. And if your testosterone stays low, that's been associated with an increased risk for heart disease, osteoporosis, all these things. But a big issue is the hard part is a lot of guys won't initiate like checking testosterone because they also have like low motivation. They're kind of clinically depressed too, and they're just kind of stuck in this rut. They're like, yeah, I'm the main breadwinner. I what fills my cup is my family succeeding, so I got to do whatever it takes. And it's hard because some of them might have that high work ethic where there's kind of do that's kind of like my weakness. Of like I got to do whatever it takes, and that's that at the sacrifice of myself. And it's a learned behavior for me. I learned from my parents at certain points in my parents' lives, they were each working like two jobs because I have three other siblings, and they were doing whatever it took to make ends meet. And so I have that learned good work ethic to a detriment where I'm like, now I'm burned out. So being a concierge doctor has really helped out. But also for me, what I've kind of found my why, and I'm really not sure. There's some of this has to do with like everyone has to find their why they want to
Yeah,
do it. So for
yeah,
me, I will focus on stress reduction things, work-life balance now because it's enjoyable. But I'm trying to remember what made it for me, what made the light bulb go off. So I try to kind of convey that to patients. A good example is like trying to tell people to exercise. No, it's super hard,
hmm
right? We talk to patients all day, every day. Like, I just want you to walk or join a
yeah,
gym or something. So everyone has their
hmm
different method
yeah,
of why they exercise. What's their why? So the reason why I play basketball is like I know it's good for my heart and diabetes control, etc. But I do it because it's my community. I've been playing with the
yeah,
same set of friends playing basketball for like last 10 years. And
hmm
so I love talking trash with them. I'm the old dude on the court. And so they love talking trash to me, but I could dish it, I could take it. But it's fun. I'm hanging out with my friends. And so some people do their weekends out to, and that's their community. And hopefully
hmm
one of the thing I kind of impart on patients, and I should do this more with men, is like you really have to surround yourself with people who are trying to succeed and
yeah,
hang out with people who are healthy. If you're
yeah,
hanging out with people who are couch potatoes and are negative Nellies, they just doom scroll all day, every day, you're gonna do the same thing, right? So we're
yeah,
like the average of the people we hang out with. So you
yeah,
got to hang out with some successful people. I just met with some friends
hmm
over the weekend, and they're like, we were all giving our advice to another colleague in healthcare, and she's burned out for sure in
hmm
primary care. Right? You got to find a good mentor. You got to hang out with people like us
yeah, yeah,
and do what we do to succeed. And so for
yep,
me, I had to find it myself, and it's not always a genetic thing. And some people like it's just their upbringing. That's not always the case. I know some folks where I've seen siblings, brother and sister, who grew up with the same parents. One is super successful, the other one's not. Same parenting techniques. There might have been
hmm
something different in there, just male,
hmm
female, maybe some biases, but it's more
hmm
the male who's not as well.
yeah,
So I don't know what's up with this our gender, if it's just a learned behavior, but they need to find something to kind of flip the switch so it can be like that scare tactic, looking at lab values. So
yep,
that's a big reason why we look
data,
at lab values. So like your cortisol is crazy, your testosterone's bottomed out, your B vitamins are tanked or whatever. So when they see that
hmm
data, that's a nice motivator. And that's the nice thing about tech now. As you know, we have a good example is the CGMs, continuous glucose monitors.
yeah,
That's real time blood sugar readings. And so people are like, oh man, my blood sugar, I've been eating this banana in my smoothie every day. And like, I had no idea that it spiked it up that high.
Yeah.
Or I'm sitting in a meeting and I'm not eating, but my glucose is going up, secondary to
Mhm.
cortisol, stress hormone going
Yeah.
up. So I think the big thing I always like, and I mentioned this a bunch of times, is that objective data. It's a big
Yep.
motivator for people versus me guilting, make shaming my patients, because it
Yep.
really often they don't come back to us because they're afraid of our judgment. A lot of times patients are
Yes.
like, yeah, I've been eating bad, so I didn't want to repeat my cholesterol, and so I'm giving it a few more months. I'm like, all of a sudden, 9 months to a year later, I'm like, you're back.
Yep.
And often they'll admit, they're like, yeah, kind of felt bad. You were telling me all this stuff and I didn't follow through with it. Like,
Yeah.
no, we encourage you to follow. You don't need all A pluses. That's what all they want. They all want the A plus. I'm
They,
like,
my A pluses for sure. Yeah.
that's a nice goal to shoot for with once you get that data. So that's right now I usually have like a motivational talk and like getting the data for sure. But yeah, our gender.
I think it's so important to really, like you said, look at what somebody's why is. Community is huge. We know that those who are centenarians are typically have strong communities around them. It's not very common. You have a centenarian who lives in a socially isolated environment, and you have people who are engaged in their families, engaged in their church, engaged with friends. But I do, going back to the middle aged individual who struggles with some of that lifestyle change, I always wonder what is their story of what they deserve, what their value is. I try to ask some provoking questions around that. And again, I think that there is some really important, not only generational, but um, gender specific in the more traditional sense. Obviously,
Hmm.
not everybody identifies with this, but more gender specific roles of being able to take care of your family. And then conversely, with women who are working full time and are taking the brunt of the child raising role and having to perform at a high level, and always, they are never off. I deeply relate to this demographic of women who you just never are off. And it is such an intentional decision to know how to curb some of those demands and make sure that you are making time for yourself. Otherwise, you will hit a wall. And this is,
Yeah.
again, just this burnout conversation. So, I really appreciate kind of your perspectives. If you were to leave our audience with some things, action items that you would recommend if they're in a place in their life and they're experiencing what they would describe as burnout, physically, mentally, emotionally, maybe their relationships are stressed, their anxiety, depression, physically they don't feel well. What are some first steps that they could take, whether it be with their doctor or with seeking things independently? What would you recommend they
Yeah.
go?
Yeah, I think top one is going to your doctor. So many people just don't go in for an annual physical. These are screening tests covered by insurances. People are paying for the insurances and don't utilize their insurance. So number one is like make sure you get your annual physical. Then you can have that conversation. During our annual physicals, we actually screen for anxiety and depression, right? We give them certain questionnaires, we ask some questions, and then we run a bunch of labs. And we do more than just the standard annual physicals a lot of our audience might be used to doing. So we'll do a lot more comprehensive tests, and we do a lot more history taking too to add on to those tests. So that's number one, is just seeing your provider and starting off just with that. And if not that, tell them you're burned out or whatever, and they can do a good workup from that. I think the next good thing is to maybe just work on education. So some people listen to various podcasts or read a book. You're touching on some things like blue zones. So some people just read that book, Blue Zones. I heard they made like even a Netflix special or
Yeah,
something about it.
documentary.
Documentary, yeah. So
Mhm.
there's something to it, and like educate yourself. I don't listen to a ton of podcasts anymore. I just focus on having fun. Podcasts are fun for some people, but I'm like educating yourself is good. If you have a primary care provider and they're not giving you that education, Number one, a lot of times, and by the way, so for our listeners, a lot of the providers out there, they don't mean to be rude, because we get the feedback from so many patients like they just spent 5 minutes with me, they weren't even listening, they were an hour behind, and they don't like that situation either. They're in a broken, stuck in that
Yeah.
situation,
Yeah.
unfortunately. So you do gotta give them some grace, but if it's not working out, come see us. So we got a lot more time. We got a lot more depth as far as what we're going to order and investigate and all that. So you got to look at what kind of research you have out there, whether that's just podcast, YouTube, reading a book, start educating yourself. Don't rely on AI. There's good on AI. Is mining all this data. It might be mining some of the bad data. So you can look at that data, but bring it to your primary care provider. Like, hey, I need some help interpreting this. So those are, I guess there's one more thing. When it comes to the AI and research, you got to take it with a grain of salt, man. There's so many influencers out there that might be
Yeah.
influencing y'all in the wrong way, right? A lot of the influencers don't have a lot of clinical experience like you and me. They might have been a provider maybe for a couple of years clinically, and now they're a podcaster. Don't get me wrong, there's plenty of good ones, but there's plenty of bad ones too. And a lot of our patients are just looking at these reels where it's just like really quick, talking about the hottest thing. And I'm like, whoa, whoa, whoa. Let's have the conversation first before
Yeah.
you come to me saying you want this supplement or this medication. We got to
Yeah.
do more investigation. We got to find the root cause. We can look at your other body systems.
Yeah.
So that's the one. That's actually a good piece of advice now that I think of it. And like, tread with caution online on that
Yeah.
education.
Yeah. Yeah, and I would add that the wearable devices, I think, are useful. As you just pointed out, technology has its limits, and I have lectured on the use of biometric wearable devices and their utility. And for example, heart rate variability being a really useful metric in tracking somebody's recovery from burnout or decline into burnout, further into burnout. And so it's a trend, and so all of the current wearable devices that are commonly available, Apple Watch or Ring, there are others, can all measure Garmin watches. They can all measure a heart rate variability. And that, I think, can also be a way of assessing roughly whether somebody is going in the right direction or the wrong direction, given whatever intervention they are choosing to undertake. So if somebody decides to take our advice and start a meditation program, which I often use the phrase, I want you to fall in love with meditation. There's 1,000 apps out there, different approaches, different styles. Find something that works for you, but I want you to try to fall in love with meditation and at least practice 5 minutes a day. You can do it in your car, you can do it before bed, you can do it however, but try to fall in love with meditation. That practice alone has been demonstrated to improve this heart rate variability metric, which then, just like a continuous glucose monitor, that you can see what's impacting your blood sugar, which we do see that improvement in HRV impacts blood sugar. The two are not completely separate, independent variables. We can see this improvement. So if Dr. Corsilles or I or another provider gives you rhodiola, for example, is that rhodiola working? Well, there's not a good blood test to tell us if it's working. Not necessarily we're going to retest cortisol every 3 months through saliva. But this, again, this heart rate variability is something that I think is useful, not perfect, but useful, and that we should be thinking about as a way of supporting patients. I loved our conversation. I appreciate you so much, and you've been such a gift to not only Vita, but to so many of your patients. I know that you're a really busy guy clinically, but just people truly love you, and the connection that you bring to your patient community is just, it's very valuable. So thank you for what you do, and thank you for joining today.
Of course. Yeah. Thank you so much. It's been a great time, and always love to explain and share my experiences for others to learn from.
Amazing. This has been another episode of the Vita Vitality podcast. I appreciate you joining us today, and we look forward to seeing you next time.